listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, we explore the complexities and opportunities of chronic condition special needs plans. What are these plans and who qualifies for them? We'll look into it all on this episode of the Agent Survival Guide podcast. The Beginner's Guide to C-SNPs, written by Roxanne Anderson. Have you ever considered selling chronic condition special needs plans, also called C-SNPs? C-SNPs are one of the lesser known and not as heavily marketed products in the Medicare world, but they can allow health insurance agents to keep selling Medicare Advantage or MA plans during lock-in. Here are the basics of what you need to know about C-SNPs so you can decide if you'd like to start offering them. C-SNPs are a type of MA special needs plan meant for individuals with certain persistent disabling conditions. They can provide coverage for people with one or more select chronic conditions outlined by the Centers for Medicare and Medicaid Services, or CMS. At a minimum, C-SNPs must offer the same Medicare benefits that all MA plans must offer. These plans go beyond traditional MA plans and aim to help their members manage their chronic conditions, avoid hospitalizations, and improve their health outlook. Oftentimes, they customize their benefits, networks, and drug formularies to better meet the needs of their members. For example, a C-SNP for people with cardiovascular disorders may have a network or formularies that specialize in treating these disorders. These may include specialists or drugs used in the treatment of this qualifying disorder. Unlike standard MA plans, special needs plans like C-SNPs must include prescription drug coverage. Someone may qualify for a C-SNP if they have Medicare Parts A and B and the chronic condition or conditions specified by the plan. The applicant must be able to prove they have the chronic conditions and live in the service area of the C-SNP. A doctor's note will usually suffice as proof of the chronic condition. Medicare.gov and the full written version of this episode have a list of some of the chronic conditions that may qualify someone for a C-SNP. CMS.gov also lists additional conditions that may qualify someone for a C-SNP if you have a client who you think could be eligible for a plan. See the article listed in the show notes for more information on which conditions could qualify your clients for a C-SNP. According to Milliman, the most common type of C-SNP plans offered is the grouping of cardiovascular disorders, chronic heart failure, and diabetes. So when can you sell C-SNP plans? In general, agents who offer C-SNPs can sell them year-round. Like with other MA plans, you can sell C-SNPs during the annual enrollment period. You can also sell them during a client's initial enrollment period, when they are turning 65 or newly qualifying for a C-SNP. Individuals who newly qualify for a C-SNP get a unique special enrollment period to join this type of plan. There are opportunities to connect with clients all year. Generally speaking, we recommend having a few C-SNP carriers in your portfolio. This way, you're ready to help clients with chronic conditions that may qualify for a C-SNP. To stay compliant, you don't want to search for C-SNP clients in ways that could be considered cherry picking, which could be at health screenings, health fairs, or genetic testing results, among other examples. Here are a few compliant ideas for prospecting for C-SNP clients. Consider the regular prospects that you encounter. CMS rules allow an agent to ask their client or applicant if they have one or more chronic conditions corresponding to available C-SNPs in their market. Let's say you have a client with diabetes. An agent could say, this carrier, insert name, offers a plan that is specifically designed for people with diabetes. Would you like to learn more about this plan? If the client's answer is yes, a presentation on the C-SNP plan may be appropriate. You can also make affinity or business partnerships. Develop relationships with providers who see prospects with qualifying conditions. Compliant, provider-based marketing can be a key to success in this market. Finally, you can turn to your existing C-SNP clients. Don't forget to ask for referrals from your existing C-SNP clients. These beneficiaries may know others with similar conditions. Here's a tip. If you're contracted with a carrier that offers agent-sold C-SNP products in your market, reach out to your local sales manager to discuss potential compliant marketing opportunities. Many carriers also offer CMS-approved materials. If you can't specifically target C-SNP clients, why should you sell to them? Simply put, nowadays the chronic conditions that qualify clients for a C-SNP are pretty prevalent across the United States. According to the Centers for Disease and Control Prevention, 38.4 million American adults are living with diabetes. The American Diabetes Association reports that about 29%, or 16.5 million, U.S. seniors aged 65 and older have diagnosed or undiagnosed diabetes. For more examples of chronic condition prevalence in the United States, see the article version of this podcast. You will likely meet many clients with one or more of these chronic conditions. They can receive more focused care in a C-SNP than other types of MA or Medicare plans, so it's important to offer them access to these types of plans. You may be wondering how C-SNPs differ from low to no premium HMO MAPD plans. Many C-SNP carriers offer plan benefits designed exclusively for beneficiaries with the qualifying conditions. For example, a diabetes C-SNP may offer a customized prescription benefit for some diabetic medications. The plan may also offer low to no copays for certain specialists to treat their condition. Also, C-SNP plans put a large emphasis on enhanced care coordination and generally provide access to care managers or clinical advisors and special programs to help clients manage their condition. It's all right if C-SNPs might have not been on your radar until now. You don't have to sell every single type of plan and attempt to accommodate every single person. However, a lot of people you're working with now or in the future may qualify for these types of plans. That's a lot of potential business on the line and a lot of clients that you could help gain affordable access to care they need the most. Want to learn more about C-SNPs? Check out our free guide to prospecting and selling C-SNPs. Go in depth on what C-SNPs are and who qualifies for them, ways to find C-SNP prospects, tips on selling, getting contracted, and more. Use the link in our episode notes for the complete guide. We'll see you on the next episode of the Agent Survival Guide podcast, when we go with Sarah as she sells seashells down by the seashore. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Roxanne Anderson. Script adaptation, recording, and production by me, Jeff Snyder. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen. Be sure to rate and review our show on Apple or Spotify.